Thank you.
All right. Good evening, everybody. Thank you for attending NYSTRA's 25th Annual Multi-Day Conference. My name is Jackie Dyke, and I am the moderator for today's session. If you have any questions about conference-related issues, please message me directly in the chat, and I will reply. If you have questions for the presenter, please hit the raise hand button, and the presenter will be notified that there is a question. Before we begin, please be sure to mute your mic unless you are asking a question or participating in the discussion. Please be sure to turn off or silence all cell phones and communication devices as well, as refrain from using these devices during your session. If you're seeking CEUs for the session, you will receive 0.15 CEUs at the end of the session. There are 2 requirements to receiving credit for attending any live sessions. At the end of the session, you will be asked to comment your full name in the chat section. So when we end, just make sure you write your full name out in the chat box. You will also be asked to complete the attestation form at the conclusion of the session. The link will be provided in the comments. You must attend the entire session to receive the full CEU credit. If you have trouble uploading the attestation form to the Google Drive, please email it to nystra2021@gmail.com. It's the same attestation form that we have used for all sessions so far, so if you already have it, you do not need to re-download it. You do not need to send the form immediately, but it must be received by us by June 13th. If you are having trouble, you can email the form to nystra2021@gmail.com. Reminder, please keep track of any live sessions you attend so that you can be sure that you're getting credit for all sessions. At the end of the conference, NYSTRA will send a proof of attendance to everyone who registered for the conference. However, if you need proof of attendance earlier than mid-June, please email nystra2021@yahoo.com or nystra2021@gmail.com after you completed viewing all of the sessions you plan to attend. NYSTRA will send the CEU information to ATRA for processing. All CEU record forms will be directly sent from ATRA. Okay, it is my pleasure to introduce our speaker. Jan Monroe is a professor of recreational therapy at Ithaca College. She has been engaged in interprofessional work for over 40 years. She also has experience in child and adolescent psychology, clinical supervision, and work with stroke survivors through the Center for Life Skills and Interprofessional Learning Lab for PT, OT, speech, and recreational therapy students. Sammy Spisak is graduating this summer from Ithaca College with a degree in therapeutic recreation. Congratulations. She has had experience working with stroke survivors at the Center for Life Skills through Ithaca College. The majority of her experience has been working with children with autism and other developmental disabilities. Kelcie McNamara is a senior in the therapeutic recreation major at Ithaca College as well. She can tell you a bit about herself. So now I will go on mute and I will be watching to admit people from the waiting room and to answer any questions. Thank you. Enjoy.
Go, Kelcie.
So I'm Kelcie. I'm a therapeutic recreation student as well. I also have experience working with the Center for Life Skills along with Sammy this past 2 semesters.
Okay, so I get to start off this show, and there's not a whole lot of people on, so perhaps we could just do a quick go round. If each person could introduce themselves and indicate if you have telehealth experience, okay? So I'm going to start it out with Miss Gooch, and then you could pass on to the next person.
Sure. Hi, good evening, everyone. I'm Catherine Gooch, and I also teach and run a few programs at Ithaca College. And yes, I do have some telehealth experience. And I will pass it on to, is it Chrisley Wood?
Hold on.
Oh, okay.
Sorry, I was eating.
Oh, no problem.
I'm Crystal Wood. I work at Loretta with their PACE-CNY program, and I have extensive background in telehealth. I'll pass it to Lynn. Or not.
Here she comes.
Hi, sorry about that. Took a little while to find the right buttons. I work in long-term care. I am actually in southeastern Pennsylvania, although Ithaca is considered home because I'm actually from Hammondsport, which is Cuba Lake, one lake over. And I have absolutely no telehealth experience, none whatsoever.
Okay. Pass it.
Matthew.
Matthew said he's a CTRS who works with youth at a residential treatment facility for behavioral health. No telehealth experience. Sorry, I don't have a mic or camera that is working right now. So Matt is going to pass it to Lonnie. Maybe. Lonnie? All right, so Sammy, do you want to go ahead and start the screen share? Okay, so as you all know, this presentation is entitled Insights on the Design and Implementation of Recreational Therapy Telehealth Interventions. And I wanted to ask each of you what your experience was, just so that we could have a sense of who we are speaking to. This is a small group, and I think that my strategy for presentations and learning is that we do a presentation and we provide what we know, but then there's people in the audience who will inform our knowledge. And so please feel free to share your ideas and to ask questions as we move through this presentation. Go ahead, Sam. The session description is really based on, what do you do? You're a recreational therapist, you're working with individuals in a clinic, and all of a sudden you can't meet face-to-face with individuals in need of rehabilitation services. And so this session really is going to be informative as well as interactive. And basically, it's going to be based on the experiences of Sammy and Kelcie as they learned very quickly how to do telehealth and how to maintain programming for the clients that we have at the Center for Life Skills. So we'll describe implementation of telehealth programs. We'll discuss some barriers and solutions, and we'll provide online resources for developing interactive interprofessional interventions. The learning outcomes would be to describe 3 benefits of providing recreational therapy, telehealth interventions, understanding of 2 helpful tips when planning for client-centered telehealth, engaging, we're going to have you participate in at least 1 telehealth experience, and then understand some barriers that we came across. And again, since some of you do have good experience in this area, please feel free to share those ideas with us. So the program initiated at the Ithaca College Center for Life Skills. We do have Catherine Gooch with us on this call. She is the director of the Center for Life Skills for Ithaca College, has done a fantastic job of making that program what it is, and also maintaining its interprofessional focus and providing students with great learning experiences. Some of you probably have heard me speak to this before, but the Center for Life Skills is an experiential learning lab. It was the brainstorm of a group of internship coordinators about 20 some years ago. when we realized that people post-stroke were not getting services after they made it through all of their insured rehabilitative services. So we decided to get together, and we have physical, occupational, and speech and recreational therapy students who come together to provide services for individuals who have experienced stroke. And I'm going to see, Sammy, if you could run the video to give a little bit of an overview of what the Center for Life Skills is all about.
It's so rewarding to work with people who have different disabilities and improve their quality of life. The Center for Life Skills is a program for people in the community who have experienced stroke, and also a place for therapy students from Ithaca College to practice their skills clinically.
We're fortunate enough to work in this space at Longview, which is an independent living facility for seniors. This is a safe environment. When the students are here working with their patients, they're supervised by a clinician 100% of the time. The students represent 4 main different departments, which is recreational therapy, speech therapy, occupational therapy, and physical therapy. We're really trying to break down the barriers and build bridges between the therapies.
Working with different disciplines and formulating our therapies together and our goals together benefits the participant. A recreational therapist is a person who oftentimes works with people who have disabilities, and we use recreation and leisure as a means of therapy. In bocce ball, that's fun because both of my participants were interested in the activity and did it when they were younger, but they were also working on their effective arm. One of my participants was working on her grip skills with it.
I'm at a really unique position here as a program manager that I can see a real growth between the students and the participants. They're working on the interpersonal skills, the professional skills, how they can adapt or modify activities or programs to meet the needs of the clients.
In therapeutic recreation, we assess participants to look at their leisure interests, their strengths, and what goals they are working on. And then we plan programs to fit those strengths and interests and goals. And then we implement those plans by actually running the session or the program. With evaluation, we determine if the participants have met their goals, and then you decide what the next step is to take. I have become very passionate about therapeutic recreation. Going through the process myself and these different fieldwork experiences has motivated me, and it helped me discover what I wanted to do with my life.
So that was a brief clip of the Center for Life Skills. One of the things that you probably noticed is that it is focused on recreational therapy, but we do at CLS make a conscious effort to do co-treatments with the other disciplines so that the students are learning with and from each other. So you saw a smattering of the kinds of programs we offered when the center was live, as well as you could see the room which we worked in that video. But what happens now? You know, all of a sudden we have COVID. And COVID, I think, really put a kibosh, I guess, on a lot of the things that we do or did in the clinic. And we had to become creative in terms of how we were providing services for our clients. It was a big effort. We owe a lot to Catherine for her wonderful organizational skills and ability to coordinate and get clients to come at different times than what the program is normally offered. And then the students working together to provide great programming. At this point, I am going to sign off, more or less, monitor the chat. If anybody has any questions, I will be monitoring that, and I will help the students answer those questions if they have them. And so I think it now goes to Sammy. I don't know who's
Kelcie.
next.
Yeah.
Kelcie,
So,
okay.
so going off that, with the shift to everything being virtual, we really had to focus on doing the same interventions, but really using a different mode of delivery. So we tried our best to modify and adapt different interventions to meet the needs of clients through telehealth. So that looked like individual sessions. We did small group sessions, 2 participants in a group. We also did group sessions of 8 participants, interprofessional interventions with speech pathology students. And then we also did intergenerational programs and community integration we focused on as well.
So I did a little research outside on whether telehealth was effective as in-person interventions. And both the studies I found claimed that it was effective and their results showed that. So the first study I looked at was the telehealth rehabilitation for stroke survivors. And the objective basically was investigating the efficacy of telerehabilitation in post-stroke patients. And the results concluded that 15 studies, so about 1,300 patients, showed improvement in motor function, decrease in depression, higher cortical function, and increased access of care for stroke survivors. And then my other study I found was the effectiveness of telehealth rehabilitation in the management of adults with strokes. And the objective was reviewing reviewing different databases, and the results show that out of about 1,800 studies, there was 13 controlled trials that met specific criteria for telehealth. And within these studies, there's shown significant improvements for individuals that have had strokes with telehealth in independence, self-efficacy, their satisfaction of life and quality of life increased, and then also improvements in their activities of daily living.
Yeah, so some of the different goals that we focused on over the past 2 semesters were long and short-term memory, fine and gross motor skills, community resources, expanding on the client's hobbies, getting them to be able to socialize with each other was a key area that we wanted to focus on, especially through this past semester. We also focus on expressive and receptive communication skills and leisure awareness education.
I'd just like to, as we flip through this, you're going to see pictures of some of our participants that were taken during the program. We do have permission for them to share, but it was kind of fun because we had clients who could not physically come to the Center for Life Skills anymore because they were in nursing facilities and had bigger problems. And this enabled them to participate again, which was really cool. Go ahead.
So we also were able to do a co-treatment with speech pathology students. We worked one-on-one. I worked in a co-treatment with 2 speech pathology students and 2 stroke survivors, and Sammy was able to work one-on-one with a stroke survivor and a speech pathology student. We were able to work weekly with both of the in our co-treatments, and we conducted small group sessions that focused on effective communication, money management, enhancing coping strategies, and then the co-intervention with speech pathology was used to create effective programs that work towards addressing participants' goals. And then we were able to combine both speech pathology and recreation therapy strategies to enable participants' success. It was really a great experience to be able to interprofessionally work with people in different disciplines and find ways to work together towards achieving the participants' goals.
So I was able to work one-to-one with a one-to-one session for participants. And I also worked alongside with speech, but it was just with one student. And we were creating common goals for them to target. And the difference between the group sessions and the individual sessions was that they were more individualized. So we focused on specific goals that the participant needed to work on. So one of the examples is one of my participants needed help finding more resources. So our job as like a recreational therapy student was to help them find more out about their interests and help them find resources either online or in person. And then another thing I looked at was multiple activities in one session. So one of my clients required more prep and more activities than just doing a couple. So it's really important to have many backups and many games as possible prepared for each session. And one thing to remember and to keep in mind is that each activity has a purpose. So there's always a purpose being held for the participant so they can reach their goal. And it's not just a fun activity, even though sometimes they are, but there's always a purpose behind those activities. And then we meet in a group once a week via Zoom for both the fall and spring semester. And we created engaging and meaningful TR programs that promoted clients' goals. And some of the activities and interventions that we offered were online games, so trivia, Family Feud, Jeopardy. There's also Shake a Memory, and we did exploring podcasts and virtual field trips, which was relatively new this semester that we did. We looked at volunteer activities, and we had a couple of guest speakers come in, and the participants really enjoyed seeing outside faces from the group. And then another thing we looked at was Explorer Spotlight. So this was a new addition to Center for Life Skills, but basically each participant had the opportunity to share about themselves, and we gave them about 15 to 20 minutes where they could share anything about their life that they wanted to. And then the other participants had the opportunity to ask them questions, and they really, really enjoyed this, and it really helped them with the socialization aspect, which is what they really wanted within the groups. And then I have a couple slides of clients' feedback. So we included 2 different surveys that we sent out to the clients. And the first one was just getting to know what the clients were interested in doing during the program. So we sent this out in the beginning of February. And one of the questions I pulled from the form that we sent out was, what are you interested in doing during the TR sessions? And as you can see, like the biggest ones were the social games. So a lot of them liked the board games or Family Feud and that sort of thing. And then they also really enjoyed music, nutrition, movement therapy, and guest speaker. So we were able to do quite a few of the ones that they really wanted to do. And then if we weren't able to get to them, we provided resources at the end of the semester. And then the other assessment that we sent out was a leisure assessment. So we just wanted to know kind of like a midpoint of the semester to see how satisfied they were with the recreational therapy groups that we meet. And these are the two questions I pulled from the form. And so we didn't get as many responses from this survey, but a lot of them really enjoyed Jeopardy! And we also asked what they would be interested in hearing from a guest speaker. And then this one's a little more like diverse in that they all wanted different things, but we were able to have someone with a music background come in, and then we also had someone that owned a calzone pizza shop. So we got to see two very different things, but they both enjoyed both the guest speakers. And then, so some ideas for programs. So the biggest thing is to always start with an icebreaker. So to get the participants engaged in the activity and to get to know each other. And then the next thing is to engage and interact with participants. So using their names, asking them directly if they want to answer or have questions. Another thing is getting feedback. So always asking the participants themselves what they liked or didn't like about the activity or intervention, and then what they want going forward. And then another thing is including participants in the process of planning for interventions. So this, we did this the whole year, but we also incorporated it more this semester by sending out surveys and asking more follow-up on interventions. And then the last thing is to be creative and to really help or really get them involved in the planning for the interventions as well.
Yeah, so going off that, some helpful tips that we found when working with clients through Zoom, through telehealth was for visuals, making sure that the PowerPoint's on steps that will be done during the session. So making sure that you have the step-by-step. Also, using pictures that can go along with the slides to help reinforce the understanding. And then utilizing the chat box. This was helpful for the clients that we were working with that had aphasia. Also, having the small phrases typed for people to look back on. So having that visual on Zoom using PowerPoint is really helpful. Also to be aware of certain freezing points on Zoom that Zoom can freeze, and also making sure that you give clients time to be able to have that feedback and not speak over each other. So giving them time to be able to communicate. And then also you can utilize headphones to enhance hearing. We had some trouble with that this past semester and found that the use of headphones was really helpful. Also, to be aware of visual and communicate issues that impact the processing of information is another area to work on.
So I'd like to just do a brief input here. I think that if we go back to the helpful hints, you should all remember that this is with these groups were designed for stroke survivors. And the key, one of the really great things about this program was our students got to work with the speech and language pathology students. And they're the ones who helped us really understand what we needed to do to help facilitate communication with individuals with expressive and receptive communication difficulties. So it was a really great interprofessional learning experience. I think we found that as we went through these programs, facilitating the communication from a kind of physiological / cognitive aspect was what speech brought to the table. And what we brought to the table was creativity and ways through which the clients could practice the skills in terms of communication, socialization, etc. I'm wondering if we should just maybe stop a minute here and see, since there's other people who have been involved in telehealth, if they would like to share some of their ideas for programs or helpful hints. Crystal, you said you did a lot of telehealth programs. I'm wondering if you could share with us some of the things that you learned and that you have done to make these programs effective.
I'm on the fence on what with my population. A lot of them just
You did.
no. I'm not.
I can hear you.
Yeah, I'm not muted. A lot of participants just don't have know-how to
I don't
access
mean to put you on the
technology.
spot, but. And what did you do? How did you facilitate that?
We're still working on it. Being in like not being able to meet people in person, like it would be so much easier for me just to like, I work primarily community based. So I'm like, it would just be so much easier if I could just go to their apartment, set it up for them, show them how to work it. So trying to remotely tell them how to do it, it's just not working. So
Okay.
we're trying to utilize like different technologies, like grandpads, I think has come up recently. And we think that might actually be better. It's just trial and error.
Jan, I think you froze.
Who, me? Yeah, I have unstable internet.
Yeah,
Can you hear me?
froze, but now you're back.
Okay. One of, we had a third student who participated in the Center for Life Skills with us during the fall semester. And one of the things that she did was she had one-on-one sessions with one of the participants who was having difficulty with technology. Fortunately, our stroke survivors do have like sons or daughters or caregivers who are willing to sit down with them. But what JoJo did to help facilitate that was she actually figured out what kind of computer the woman had. And then she took screenshots, and then she provided very specific directions with those screenshots, and then shared them with the daughter, who printed them out so that the individual had them step by step next to their computer. And both the daughter and the mom were very excited about that approach because it's so that the daughter didn't have to come over there and turn on the computer and get her set up. But it takes a certain amount of time, but having, again, those visual cues. I don't know what population you work with. Did you say?
Sorry, I lost my mouse. I work with older adults, and a good chunk of them have dementia,
Okay.
which is another barrier that we have. So just being able to
Sure.
retain
Okay.
information is difficult.
Right. So again, having those written instructions in big bold letters, I think was helpful to some of our folks. I have a note here from Lonnie who says that she hasn't done any programs, but her second job, they do physical fitness and social skills, and has worked out very well. Yeah, one of our concerns, I think, when we were doing these programs was how safe, and maybe Catherine could speak to this a little bit because she had to deal with some of the risk management issues. But how safe is it for us to do physical activities if there isn't a therapist there with the individual that we're doing telehealth with? So Catherine, can you speak to that for the group, please?
Yeah, sure. Thanks. Yeah, and I was going to say one thing with part of the Center for Life Skills program, we had a real advantage because we had I've been with the program for 20 years. So I had a list of past participants. So they come through our program, some of them for 1 semester, some for 3 or 4 or more. But for the past 20 years, I had a pretty large amount of participants to go through. We knew we needed maybe 8 to 10 participants for the different therapies. So we could almost hand select them. And we did that based on 1, their interest, and 2, the biggest issue is technology, whether they understood technology, had technology in their home, or had assistance with technology. Just because with our students, what we had to do, we had to turn it around pretty quickly. So in our past fall semester, we did have speech therapy, as Jan said, therapeutic recreation, and occupational therapy. This past semester, we didn't have occupational therapy, but we did have physical therapy. So with that being said, whatever therapy they had, I made sure that everyone signed off on confidentiality. But specifically for physical therapy, we had a waiver. So because our therapists have known these patients from the past, we knew they're pretty much their functioning level and their judgment, are they going to be safe or not? So for the ones who were involved in physical therapy, if we determined, and I did kind of an assessment for them coming into the program, and we reassessed them because some of them maybe we haven't seen for a year or two. We determined if they would be able to participate in telehealth for physical therapy virtually, independently, or do they need maybe just standby assistant, or do they need somebody right next to them, actually, if they were doing a sit to stand exercise, a family member or a caregiver could be hands-on. So we determined that early on, what the level would be needed and if they would have that close supervision at home for physical therapy. And they had to agree that they would provide that or they couldn't participate. And for the other therapies, we just looked at technology and how accessible is it for them and how could they, how much assistance do they need from the family? Then do they need to be there? And what was great about Jan and the work that the students did is that some of them, at the beginning of the program need a lot of assistance. And because of their initiative and their planning and education with the students and the families, as well as with speech, they were able then to wean away as much assistance where, like you said, another student did printouts and the daughter could see. By the end of the semester, that participant was logging on, I think we're talking about Judy, was logging on, independently, and we could walk her through and help troubleshoot. And then this past semester, because Jan was there in the fall and somebody else is in the spring, she was getting more and more independent and able to do some things. So it was kind of do some more things independently on Zoom. So yeah, I hope that answered the question. But yeah, we definitely looked at each participant, what their level of assistance would be in their home. But we did have an advantage where we knew most of the patients from prior work, and we could kind of select them if it worked for them to be involved. So that answers.
Okay, and so there was a point where I believe our risk management, our office was concerned about whether or not we could legally do this, and that all got worked out, correct, Catherine?
Right, so the college paid for us to be, all of the students were covered for telehealth, but the faculty weren't, who were supervising them. So yes, we had to get private insurance that covered telehealth because our current provider at the college wasn't including telehealth. They knew the value, what we bring to the community and how it's valuable for the students. So the college agreed to pay additional independent insurance for us, risk management, covering all of our P's and Q's, covering us for future telehealth. So yeah, so they did that for us so that we could continue. But it is kind of
So
interesting.
that is something, it's just something to pay attention to that we had not really included in this particular presentation because it came up as a, not when I was there, kind of issue. But just pay attention to it, make sure that you have personal professional liability insurance, or talk with your administrators to make sure you're covered, so that if something did happen, you would not end up in trouble.
Right. And it wasn't,
Has anybody,
I'm
ahead.
sorry, it wasn't real expensive. I think it was like maybe $120 for faculty for us to be covered up to $1 million. So it wasn't
For how long, Catherine? A year or?
for a year. Yeah. So it would be like $120 annually to cover us. And it was up to like $1 million if somebody wanted to sue us for something. But we did have waivers, but it doesn't, people can still sue no matter what, they can still try. But luckily, knock on wood, we didn't have any incidences.
Okay. Okay, so does anybody else have any experiences they want to share related to, I guess, for programs or experiences that you have had? I'd like Kelcie to spend a couple minutes, because in addition to working with us at the Center for Life Skills, she was doing a service learning project, which I was her supervisor for. Oh, my internet is not so good. And she worked with developmental disabilities. Kelcie, why don't you speak to that a little bit, your experience, the population, and the programs that you offered?
Yeah, so I worked with adults with developmental disabilities, ages about 18 to 40. So they were adults, they were living throughout Westchester County, I believe. And we did programs through Zoom. They had one supervisor on for each program that I did. I met with them 2 hours a day, two different groups, 2 hours a day. And I noticed when doing the programs with them that there was a lot of reliance on the supervisors for help with doing different activities. So we were kind of trying to work away from that. That's kind of, I came in and I did a staff training video actually that touched on learned helplessness. So creating and adapting programs for Zoom was something that they were struggling with. So I kind of made a list of resources for them that they were able to use with different programs and how we can adapt them for Zoom and telehealth, and ways that we can kind of make programs that touched on their goals, because that's something that we were trying to focus on as well. Some of the programs that we did were also, we focused a lot on money management. We did a lot of Jeopardy. They like to use Jeopardy labs, if anyone's ever heard of that. Yeah, that's a big one. We also, it was great. They were able to search it up on their own and find ones that they wanted to do. We had one person, he changed his name to Alex Trebek. He changed his name to when he wore a suit. So it was a great experience being able to have them use Zoom effectively and run programs on their own was great. Also, we focused a lot on when we did money management. I was able to take again the Jeopardy and turn the questions to focus on money management, and so it was great. Does anyone have any questions about that?
All right, is anybody else have any questions about anything we've talked about so far, or experiences they'd like to share?
Actually, I just wanted
to. Oh.
Go ahead. were you going to say something?
I was going to ask Kelcie a question. The name of did you say Jeopardy Labs?
Yeah, Jeopardy Labs. It's a website.
Okay.
I can put it in the chat.
Okay, I'd be grateful. Thank you. And the clients actually started developing their own programs, or the staff started developing programs for the clients?
Yeah, so the clients were able to search up. They have different templates for the Jeopardy Lab, so they searched the ones that they were interested in. So the different subjects, a lot of them were like geography or history, different areas of that. And they did, so they were able to search up their own templates and kind of facilitate them.
Okay, cool. Thank you.
Yeah.
That is
Also-
really cool. I had a quick question, Kelcie. When you were doing that, were you, did any of the, I guess they're in a residential setting, so they had like house managers and staff there. Did any of them suggest specific goals to work on, like social skills, or, because I know you mentioned like math and money management, which is awesome, but could you do telehealth and do work on social skills?
Yeah, definitely. So the organization, it was a community-based organization, but they worked alongside the different where they were the people that they were living with as well. So the different managers and stuff in there. So the main focus was definitely social skills. Getting connected with other participants was a really big draw for a lot of them, because they were definitely very isolated through COVID. Some of them lived together, but getting them in contact with friends that they knew through the programs for years was really a key aspect to the program. So yeah.
Any other questions from anybody? Sammy, you worked with someone who liked board games. Can you talk about how you managed to create board games and play those in telehealth sessions?
Yeah. At first it was definitely very difficult to try to figure out how to do a board game through Zoom, but I ended up making my own board games through Word, and I found them on Pinterest, and I would make them on Word and then basically make up things so each space would have something for the participant to do. So like one of them, we were working on like additions. So one of the spaces would be like 5 + 1, and then they would have to answer the question, but also like moving the pieces. And one of them was like, if you landed on this spot, like you need to ask this therapist a question. And so like it was kind of like formulating questions with the people within our sessions, and then also answering skills that we were trying to work on, such as math and reading words and stuff like that.
Yeah. Another thing that I noticed was that when a program doesn't work or it doesn't go as planned, it doesn't necessarily mean to write off the program altogether. You just might want to reevaluate it, like I feel like you've all been doing for years. Just reevaluate it and see how you can adapt it for telehealth, because it's definitely different, and things that work in person might not work through telehealth and vice versa. So it's definitely a learning experience that you want to make sure that you look into different methods.
Yeah, Sammy's participant was a stroke survivor, but she also had some developmental issues. And one of the trickiest parts with her, I think, was keeping her focused. And well, first off, getting her signed in, but then after that, she was very everywhere, right, Sammy? And so they came up with a few strategies with the speech therapist to keep her online. Do you want to speak to some of those, Sammy?
Yeah, a couple of the things that we did was we had like multiple different activities for her to do. So like typically we would spend like no more than 10 minutes on each activity, um, which had a lot of like prep, but like it was good in the long run because then we touched on a bunch of different things throughout the session. And then another big thing we were trying to get from her was finding out what she's interested in. So like really trying to find like what music she liked, like does she like art, does she like this? And through like those questions and through family conferences, like we were able to find some things that we could like get out and then hopefully use in the session so she was more engaged. So for example, like the board game, we found out that she really liked unicorns, so it was like a unicorn themed day. So like we would watch a unicorn recipe that was unicorn bark, and then we had the unicorn board game, and then so they all had a theme like each of the sessions, but there were just many different activities throughout each of the sessions that were planned.
She also liked pets, and the speech student had a dog, so the sessions would kind of start out with the little clip about the dog. I think you have to be a little careful about that because it ended up being not necessarily focused on the goals, but sometimes it became a very long story, and then you ran out of time. So making sure that, you know, whatever you're doing is client-centered. And I think the students did a really fine job of asking the clients each time, you know, what did you enjoy this? One of my strategies as a rec therapist faculty is to really push the point with students that you really need to know what goals you're working on, and you need to have your clients know what those goals are. So we always introduce the goals at the beginning of the session, and at the end we do a debrief. And that debrief is to ask them, you know, how did the session go? Did you manage to work on the goals? And typically we would go through each of the goals. Is it communication? Is it whatever? And let them give us feedback, and then talk to them about what they wanted to do next time. I think Catherine kind of hit the nail on the head when she talked about the luxury of having a client group who had worked in person together, because they already had a relationship. They were hungry and starving for being around people again. And so, you know, in some ways they ran the groups themselves and were very clear to us in terms of what is it they wanted to do, and then what kinds of activities we could do to enable them to work on their goals. But basically it was socialization. Okay, I think we could move on if there's no additional questions. Sammy, do you want to pick up where we left off?
Yeah, so going off that, some things that we learned through our experience over the past year is we learned a lot about how to modify and adapt intervention strategies for online programs, like we shared before. Really being flexible and being okay with knowing that not everything's going to go perfectly, but making those adaptations is key. Also, how to utilize online resources, such as different games, websites, or program manuals. We used a lot of like Google searching up different games and activities. That's how I found Jeopardy Labs. I ended up just looking up online Jeopardy games, and it came up, and I found out that they used it at the service learning site I was working at as well. So it was a perfect resource. We also used virtual field trips and things like that. So really looking up different activities and stuff online. You can find anything, so that's definitely key. Having a group of participants who knew each other is definitely helpful in establishing a positive group process, having those relationships already. And them being excited to come and see each other again was definitely a really good asset to our program. We also learned how to introduce interventions and goals, and having debrief to help participants understand the values of programs and activities, as well as have us get an understanding of what the participants liked or didn't like about the programs. Also, interventions encourage participants' engagement with each other outside of the group. We had participants who are planning on meeting up for lunch now after the semester. So that was definitely a great resource, is having those interventions and having those side conversations. Those participants actually had never met each other before, so it was great to see them bond this past semester. Also, having people that are hungry for opportunities to interact with each other. I think everyone that was a part of our programs was really excited and motivated to see each other and interact and be a part of programs. Also asking for input for future programming, sending out different assessments, like we showed throughout the programs, the duration of the program or semester as it goes on, seeing what clients are interested in doing at the start of programs, as well as they progress, if those interests change, because they very well could change throughout the progression of programming.
Okay, so this is a time to ask some questions related to the content or to provide personal feelings and experiences. Does anybody have anything they would like to ask or add? All right, so we promised that we would do some experiential stuff. So we have time to do an activity. And this is, you could go ahead and start screen sharing or, okay. So this is a logo quiz. And as you could see, we're very concerned about making sure that the directions are written and that the clients could see them, particularly with stroke survivors, because sometimes the auditory doesn't work and sometimes they can't speak. So it's important to have any venue you can to give them as much possibility of understanding the information. So this logo quiz, there's going to be 15 images, and we'll show a logo from a company. And the purpose is to guess the right answer. For example, the big yellow M to the right would be McDonald's. Okay, so to play this game with all of us, I think you all should turn on your microphones and we'll just see who gets the answers. Just shout it out. Okay. For you all, this might be a very simple activity, but for our stroke survivors, oftentimes visual discrimination, memory, being able to find and express words is a difficult thing for them. And so this gives them the opportunity to do that. Also, remember we had mentioned that the chat box is often used to help people with expressive and receptive communication. And if this is a hint, if you're using the chat to provide additional cues for people, be sure that you have someone who could do that who is not necessarily running the program, because that's a really hard job to put verbal cues in and still stay focused. Okay, are you all ready? Are you unmuted and ready to go? Oh, look at here, the goals. To quiz players on what they see and then what they remember. It deals with executive functioning, improving memory and attention to detail, and then communication with other group members, also expressive communication, visual discrimination are all goals that could be used or addressed in this activity. So here we go.
Nike.
Very good. All right. Next.
Apple.
Okay. Next.
Honda.
Okay. Next.
Pepsi.
Pepsi.
Okay.
Dunkin' Donuts.
Donuts.
Okay.
Wendy's.
Oh, there you go.
Mercedes.
Mercedes.
All right.
Special Olympics. Olympics.
Olympics. Okay.
Starbucks.
Okay. Okay, so obviously these are pretty common, well-known logos, but if your clients are higher functioning, you could become more obscure and find more difficult ones. I think that's one of the secrets of recreational therapy is we start at a level where it's going to be challenging for our clients, but then we're going to make it more difficult each time so they are able to enhance their skills. So, you know, I can't think of a particular logo right now, but I think you probably understand what I'm trying to say with that. So, as I said before, we always start our groups out, be they live or online, with our goals. And at the end, then we come back to the debrief questions. And these are some that we had for this particular activity. Do you think the goals of communication were met? Do you think the goals of memory were met? And then often we'll ask how, you know, to have them provide us with an example. And then what do you want to improve, or what could we do to improve this activity to help you meet your goals? What would you like to do? Would you like to do more activities like this? And are there suggestions for future programs? And you'll find that as time goes on, the participants are going to be more and more willing to provide you with information on how we could best meet their goals. Oftentimes as therapists, I think we forget that component, that we think we know the best way of helping our clients, but oftentimes our clients really know themselves better than we do, and they could give us hints into how we could work things out. All right, so the next activity is shake a memory. And who's going to do this one, Kelcie or Sammy? Because I've not done this activity before.
I can do it.
Okay, go ahead.
So basically the how to play is there's 22 slides, and you basically will pick a number 1 through 22. And this number correlates with a question. And so the purpose of the game is for the clients, specifically for stroke survivors, for them to recall basically either stuff that's been in the past of their life, or things that they have to dig a little bit deeper to remember. So if someone would like to pick a number 1 through 22 to start us off.
I'll pick 3.
Okay. So answer this if you have traveled outside the United States, and if so, do you remember where it was?
Germany, the World Tap Championships. My daughter won the gold for the USA Tap team.
Oh, congratulations to her.
Yeah, thank you.
You're welcome. Does someone else want to pick a number 1 through 22?
I'll take 16.
So answer this if you have a hobby, and if so, do you remember what it was?
I'm not very good with hobbies, but I love TV.
There you go. And then sometimes we would ask further. So we'd be like, do you, what is your favorite show to watch? So if you would like to answer that.
Yeah, I'm thinking. I don't know if I have anything that's a favorite right now. Oh, so you think you can dance?
Nice. Does someone else want to choose a number 1 through 22?
I'll pick 12 or no, 10.
Okay. Answer this if you enjoy a fall activity. If so, do you remember which one?
Fall activity. I love hiking in the fall.
Nice. Does
And-
some, yes.
Where do you like to hike?
I like to hike. Yeah, around the Tompkins area, all of our waterfalls and things that we have luckily farmland behind us, so we can go right out our door and go hiking, and the leaves, the maples especially look really pretty. So yeah, just locally, it's just really, really pretty. We're lucky here in Tompkins County.
Mhm.
I'll pick 21.
Answer this if you had a job. And if so, do you remember what you did?
Yeah, I was a professor, and as of August 15th, I won't be that anymore. Something
wow.
I
Congratulations.
ended up doing. It's kind of funny that that's what this question
Oh,
was.
it is.
So I guess I still have a job, but not for much longer. But I'll probably continue to do sessions. So, has everybody had a chance?
Take 22.
Answer this if you went to a music concert. If so, do you remember who you saw?
Which time?
I guess maybe your most recent one.
I went to a show. No, my last show is November 2018. I saw a band called Hailstorm with In This Moment and New Year's Day in Norfolk at my college.
Oh,
I
wow.
went to.
That's pretty cool. Did everyone go? Or everyone that wanted to go?
No, it was just it was in the entertainment venue, which
Oh,
is where they also had like the basketball games and stuff.
like in the gym kind of thing? Arena?
Yes, arena. That's what I'm looking for.
I know, I was trying to figure out the word.
So I just have to share this because it's such a post-COVID, although we're probably not post-COVID yet, but I was in Colorado and I got to go to a kind of bluegrass-ish concert at Red Rocks in Morrison, Colorado. And it was just so great to hear live music again. It was pretty awesome.
I bet.
All right, so where are we at now? Let's talk about the resources a little bit.
Yeah, I'll pull it up. So we created a list of resources below in this slide, and then we have more also, but these are a couple of ones. So we have the Jeopardy Labs. We used a lot of podcasts from Google. Some were effective, some were not, just because of the speed that the person talked. So that was a little bit of a difficulty. And then another thing that we found this semester was chair yoga. So having the participants being seated, so there's not a safety concern, and then following along with the video. Although sometimes it was difficult for some of the individuals because of the visual neglect, but it went pretty well. And then another thing was we found this resource, the virtual team building games and icebreakers. And we can also include that in the chat as well. And it has a bunch of different icebreakers and games that could be played or done as interventions. Jan, I don't know if you want to talk about that one.
I'm trying to see if
I
can you click on the link?
Yeah, I can pull it up. I just have to.
There it goes. Okay, so this is a link. Why don't we just go to the cover first for a minute so people could see it. This is a really great resource, virtual team building activities. And okay, now you could scroll a little bit, but kind of slowly so people could see some of the activities. It is just full of different activities that could be done virtually. So here's the icebreakers we talked about. Okay, slow down there. We talked about having an icebreaker at the very beginning. And this is one where you could have people talk all about me. What is your favorite sweet treat? Oftentimes when we started our programs, our classes, it seems to be a tradition in our department, is we do a go round at the very beginning with a specific question to just get people into the program and excited about being there. And so these questions and all about me are kind of fun because they're good conversation stimulators. Let's see, what else do we have? A penny for your thoughts. I think on the penny for your thoughts, what you're doing is you're looking at the year that's on the penny and you try and see if you could come up with a story based on that particular year. I have not done this one, but if you scroll down, there's that one with the dice or the playing cards, you know, where you make connections with playing cards. I mean, we could go on forever looking at these, but I really recommend this book because it's not only good for, you know, working with your clients, but if you're trying to develop leadership programs with your folks that you work with, these are great activities to start regular meetings. So we are getting close to the time for the program to end. We have about 10 more minutes. And some of the additional stuff that we have that we could share, if you all don't have questions, is more of the evaluation. I didn't work with Sammy and Kelcie in the fall, spring semester, but Molly Hajar did, and she used Google Docs to help the students develop questionnaires. If you'd like to see some more of the clients' responses to that survey and some of the other questions we asked, we could show those. You want to do that for now? Would you like to see more evaluative information? And thumbs up, thumbs down. You're ready to go. It's late at night. I don't know. All right. Any questions that you might have then, if people aren't interested in knowing that?
I was wondering, I thought it might be nice for Sammy and Kelcie, I don't know if they did this earlier, is to talk about the Explorer Spotlight, how that came about, and because they did it this semester. And so I was like a fly on the wall. Sometimes I had to participate because I had such questions for what was going on with the participants, but maybe the students can talk about the benefits of what it was and the benefits of Explorer Spotlight.
Yeah, we can both share a little bit about that if you want, Sammy. So each week we had a participant share a little bit about themselves. Depending on the participant and their comfort level. Some we would support in creating different programs. Sammy was able to help one participant create a video about what she wanted to share because she had some aphasia. She was uncomfortable sharing live, so she did a video, and then she was also able to share a little bit with some questions after, which was great. It was just a really great way for participants to open up with each other and share a little bit more, kind of build their comfort level with each other. I think that it was really helpful. I noticed a lot of participants were able to get out of their shells with that time. It was kind of just free time that they're able to just share whatever they wanted um, about themselves or their families. Um, and it was really interesting. One participant shared about her experiences volunteering post stroke. She went on a trip and she was able to share about that. And then we had some participants share pottery and then just different things that they're interested in. So it was a great experience. Sammy, do you want to share a little bit?
Yeah, I can. I was gonna add on to that by saying, I know you touched on that about the lady that posted or had a video. So I sent her an example of how to create a video and like how to like go about it. So I showed like my cat, and I like went through the process of filming the video and everything, and then I sent it to her so she was able to see how it can be done, and like you don't always have to do something live. And so she really liked that idea, so she ended up filming a video with her husband and then sharing it, and then I ended up sharing it with the group, and then she talked about it live afterwards. So that was really awesome to see and everything. And then the other thing I wanted to touch on was it was interesting to hear about after the Explorer Spotlights that some of the participants were nervous to present when it was like their time to talk about whatever they wanted to talk about. And it was interesting because a lot of those individuals were the like big talkers in the group and they really like to share and like add on to things. But then we found out that they were extremely nervous to do it. But then once they did it, they were like, wow, like I didn't like it wasn't that big of a deal sort of thing. So it was really cool to see the progression from like being super nervous and then them like kind of like Kelcie said, like breaking out of their shell and being engaged with the group.
Yeah, and it was also great. I know I said before, but like some of the participants that weren't as talkative, we really noticed a shift in them opening up just during other programs as this semester went on, having that experience sharing. So it was definitely, it did more than you'd think that it could do for them. So
Yeah, I think just building the confidence was huge. And it was interesting, like you said, some people like, oh, well, I don't know what I'll present. And it wasn't, there was a lot of preparation work beforehand that the students did with them. Like Sammy said, is showing how to do the videotape and sending a sample, but it got the families really involved too. But I don't think there was one. I think sometimes you all might have thought I might be wrong when you were working with the clinician at the time was Molly. It said, oh, it'll be 5 to 10 minutes, and they would be going on 20 minutes, and they are still showing their artwork or whatever. Because I think one was pretty powerful, a female participant talking about her artwork and how she's talking about her processing through her recovery and the paintings that helped her through her recovery and how symbolic they were. And it was like, woo, like I just saw a tape of the whole session because there's one session I missed who's so powerful. But yeah, the students did a great job. And for the end, I just wanted to say my hat's off to Jan and the students as I helped run the program, is that they made it easy because they made it so engaging for families. And we thought, oh, are they really going to attend every week? And they were there, bells on, whistles on, ready to go. So a testament to their good hard work, and the benefits were just amazing. And the testimonies almost that the participants shared at the end of the semester, we kind of had like a virtual party, were just amazing to hear what a difference the students and Jan and the other clinicians from all the therapies made. But I would have to say, because I'm biased, in TR, you know, we work with the whole person, a very holistic approach. And we offered that connection that they were so hungry for. So my hats off for the ladies and for Jan for doing such an amazing work this past year. They really turned it around and did groundbreaking work. So my hats off for them, to them.
I would just like to say that, you know, computers aren't my best friend. And as a therapist, I really rely a lot on reading a person's body language and seeing everything from where their hands are to their tapping toes to whatever is going on with them to get a sense of how they're engaging in programs. And I thought, this is not going to work virtually. It's just not going to work. And it did. And it was just really phenomenal to watch the growth that these folks demonstrated during these programs and the growth we had in terms of figuring out, you know, teaching old dogs new tricks or young college students how to move into the future. So I guess that's it. Do you have some ending comments for us?
I'm just amazed at how much all of you were able to actually still clinically do from a laptop. Like, this is about the best scope of what I've got to work with is what you're seeing me do here tonight. And I still had to go into work. So I was still doing some face-to-face type of things, but I am just absolutely astonished with how much you ladies pulled off and how the school systems adapted and how, you know, just as a profession, we adapted. And so it's just really interesting to hear, you know, what you went through and what you were able to accomplish. So kudos. It was really cool to hear and learn a little bit about some of the challenges and how you rose above it. Thank you.
Thank you.
Thank you.
Yeah.
All right. Jesse, are you going to do any closure for us here?
Jackie, yes, I am. I wanted to thank you three so much for presenting this year at our conference. I was also super impressed with everything that you shared, so thank you so much for being here. I'm right now popping in the link to the attestation form into the chat box in case anyone needs that link. So it's the same form that's been in any of the other live sessions, or if you've watched anything asynchronously, and it's also been emailed out a few times. So it's always the same link, but just in case, it is there in the chat box. I think I've been watching, and I think almost everybody has popped their name into the chat box for attendance purposes, but just make sure that you do that before you log off. And what I will do is stop recording before I actually stop the session. And again, thank you so much to Jan, Kelcie, and Sammy. I really enjoyed this presentation, and I think a lot of us got a lot out of it. So thank you for that. And I will stop recording. All right.